surprised, I must admit. I hadn't expected this, and this is certainly a very different format to what I'm used to. So it's a pretty wide group of people with different sort of experiences, exposures to medicine and cardiology. So I hope that I'm able to, speak to everyone with what I'm going to talk about today. So, as a Christian clinician in the hospital system, we're faced with lots of different challenges, and I think it's and central to all of this. I believe it's God, um, and a lot of what we do, I believe it's really ministering God's love to people that we see on a day-to-day basis. So cardiology is a very broad topic, and there's so many different aspects of it. So I'm just hopefully going to give you a snapshot of some of the things that we see on a day-to-day basis and some of the patients that we would encounter. So let me move forward. Okay, so for those of you who have not ever seen a heart before, this is what the heart looks like. Many would say that it doesn't look very pretty, but it is an amazing organ. And to think that our creator actually created something like that, it's really quite amazing. And as Psalm 139, verse 13 and 14 says, "For you created my inmost being, you knit me together in my mother's womb, and I praise you because I'm fearfully and wonderfully made. And your works are wonderful, and I know that full well." And I hope you'll be able to appreciate as I go through this with you how wonderful this creation of God is. So the heart isn't very big. If you imagine your fist, that gives you a rough idea of the size of your heart. So it's not a very big organ. And if you imagine this organ actually supplies the entire body for the entire duration of your life, for however many years you live. And if you imagine the heart beats anywhere between 60 to 100 beats every minute, and if you imagine how many minutes there are in each hour, and how many hours there are in each day, and how many days there are in each year, and how many years you live, the heart is pretty amazing when you think about it. So it's a muscle essentially, and it requires oxygen and nutrients to function, and it gets it all through these coronary arteries that sit on the outside. So this whole network of blood vessels that you can see on the outside, that's actually the coronary arteries. Now, when you look inside the heart itself, it's also pretty amazing. You can see that here we've cut the heart open and you can see it from the bottom inside. And what you can appreciate is that it's got valves. It's got a whole network of nerve fibers, which really, when you think about it, it's like a house electrical system. So the heart has its own electrical system. It has its own generator. It has its own switch points. So it's actually a very sophisticated and highly detailed organ that is very different to any other organ in the body. So when we talk about cardiac disease as such, you can think of the multiple different things that could go wrong. Any one of these structures in itself that, breaks apart or, gets damaged, can actually result in a pathology. So when you think about how our makers designed the heart so beautifully and how it works so wonderfully, and how everything synchronizes together so well in a normal heart, it truly is amazing. Now, the heart is obviously essential for life. It pumps blood, oxygen, nutrients all around the body. And very much like the brain is the center of the neurological system, the heart is the center of the cardiovascular system. So it follows that caring for our physical heart really supports longevity and vitality. So if you want to live a long life, you do need to look after your heart. And as Proverbs 4:23 says, above all else, guard your heart, for everything you do flows from it, right? So the heart's responsible for pushing blood around the body and making sure that the rest of the organs are actually working well. But when we look at it spiritually, the heart is actually central to our relationship with God. And as Psalm 51:10 says, create in me a pure heart, O God, and renew a steadfast spirit within me. So when we talk about the physical heart, it is the organ that pushes blood around the body. But when we talk about the spiritual heart, it is really our our spiritual relationship with God. All right, so cardiovascular disease. So we hear so much about people talking about cardiovascular disease, and everyone seems to think that cardiovascular disease, especially patients in particular, all it involves is actually heart attacks or coronary artery disease. But actually, when you look at it, cardiovascular disease spans a whole range of different conditions. So we have heart attacks, of course, and that's the myocardial infarction picture at the bottom here. But part of this also is coronary artery disease. So you may not necessarily have a heart attack, but also have existing disease to the coronary arteries, which can give you problems. You can have heart failure, which is another huge problem. Then there's arrhythmias, where you have the electric circuit of the heart going wrong. Then there's peripheral artery disease, strokes, and high blood pressure, and all the conditions that come with hypertension as well. So when we refer to cardiovascular disease, we're talking of a whole range of different conditions. Now, obviously, the two most common ones would be the heart attacks, coronary artery disease, and heart failure. And that's because we see a lot of, these patients all the time. We meet friends who have had at some point in time one of these conditions. So that's part of the reason why many people seem to think that cardiovascular disease is really just those two things, but it does encompass a lot more than just that. Now, when we look at the actual prevalence of it, it's actually staggering. The numbers are frightening when we look at the statistics. So 57,000 people are expected to have a heart attack each year in Australia. And really 1 in 6 Australians live with cardiovascular disease. And in fact, more that in Australia itself, there are more than 4 million people who have got cardiovascular disease. And each year, 42,700 people actually die from cardiovascular disease, essentially equating to one Australian dying from cardiovascular disease every 12 minutes. And it costs our healthcare system a huge amount of money. So heart disease and treatment of heart disease costs up to $12.7 billion each year. And, it really does cost the Australian health system the second highest expenditure in terms of treatment of heart failure and hospitalization from heart failure and all its related conditions. So when you really think about it, it's a huge problem. It has a huge impact and it affects many people. So a large proportion of people that you see in hospital will invariably have a cardiovascular condition. And in fact, many of the people that you meet on the street or you meet outside of hospital also have a cardiovascular condition. It's not moving. So I'm just going to very, very quickly go over two of the most common cardiovascular conditions for the benefit of those who are not in medicine. So when we talk about coronary artery disease and heart attacks, we really are referring to the coronary arteries that sit on the outside of the heart that I showed you before. So these coronary arteries are really not very big. So when you imagine these are tiny blood vessels and they have a diameter of approximately 4 millimeters, and those are the main blood vessels. And what happens in a heart attack is that these vessels actually block off. And when they block off, a portion of the heart muscle that's supplied by that blood vessel actually gets its blood supply cut off and it undergoes damage, as you can see in the top picture here. How does this actually happen? So the bottom picture here, bottom little video shows you what actually happens. There's, this cholesterol deposits within the walls of the artery itself. And that's why, we keep going on and on about cholesterol and cholesterol management. And you can see that as it continues to block the blood vessel, it reaches a point where it can rupture, and the body then tries to patch that little rupture up with clotting sort of components, and that then blocks the whole vessel off, giving you an acute occlusion of the blood vessel and a heart attack as such. Now, when you look at the top 10 causes of death in Australia, coronary artery disease is right up there. It's in fact one of the top causes of death. And that's an average heart attack, in 23 Australians each day. And more than 100,000 Australians who have actually suffered a heart attack are actually young. They can be actually below 65 years old, right? And about 430,000 Australians have had a heart attack at some point during their lifetime. And most of you would have known of somebody who's had a heart attack. And in fact, 1 in 3 Australians know someone who actually has suffered a heart attack. So it has a huge impact on patients. So the big issue is that a lot of people who are at risk of suffering a heart attack are warned usually that they are at risk of having a heart attack. But a lot of the time we find that people that are warned or even sort of cautioned about needing to change their lifestyle would still continue to engage in a lot of their risk behavior, even though they've been warned. So what are some of the risk factors? These are important to understand because it gives us a snapshot about the kind of patients that we see all the time. So here is a graph that gives you age plotted against the number of events of a heart attack in 100,000 population, with the blue being men and the green being women. So what you can immediately appreciate is that men have higher risk of heart attacks than women. So men are at a greater risk than women. And this is thought to be because of the protective effects of estrogen. But as women go into the menopausal ages, they lose that protective benefit. The second thing is that we can see that age plays a factor in all of this as well. And as you can look, as you age over time, your risk of getting a heart attack goes up. And that's why you kind of don't see very many young people getting heart attacks. You see a lot more older folk getting heart attacks. Now, what are other risk factors? So the other things that we are familiar with will be things like diabetes, high blood pressure, being overweight, smoking, high cholesterol, and a family history. So how do we diagnose a heart attack? Well, really, it's from the signs and the symptoms. So the kind of symptoms that most patients will talk about would be things like shortness of breath, a lot of pain, and the pain can vary from being very intense, like you see in the picture here, to sometimes being quite mild. There can be sweating, there can be nausea, vomiting, dizziness. And when we look at someone, we look at not just their symptomology, but we look at how many of the risk factors that they have. And if you were to present to hospital, you will get a whole battery of tests. Usually an ECG, there will be blood taken for what we call troponin measurements to check. And troponin is an enzyme that gets released by the heart when it undergoes stress or damage. And then, of course, if you're not in a hospital setting and you see a cardiologist outside, there will be potentially tests that will be arranged for you depending on your risk. So we do risk stratify people and decide what to do for them in terms of their risk profile. Now, from a patient's perspective, it can be a very scary time when they present to emergency with any sort of symptoms of that would suggest a heart attack. Many of them will describe this as a wake-up call. A lot of them will say that, I would want to change what I do. And particularly with patients who've had a heart attack, you will see that a lot of time they are quite visibly shaken, and they will say, oh, I really do want to change my lifestyle. But the problem is that being human, all of us the initial stage is very scary, but then a lot of people then relapse back into their old habits as well. So it can be quite challenging. But patients at this stage, when they present to hospital or after heart attack, can be quite vulnerable. Now, the other thing that I do want to touch on is heart failure. And heart failure is a lot more common than what we think. And it can actually arise from a heart attack as well. And that's why it is quite common, because you see that lots of people get heart attacks. So a lot of them end up having heart failure as well. But heart failure isn't just a failure of the pump per se, but there are actually two different types of heart failure. You can have one where the pump part of your heart is really weak and you can't generate enough force to push the blood out. And there's the other side of the heart failure spectrum where the heart becomes very stiff and it cannot fill with enough blood. Now, both of these conditions can be quite debilitating. This is how prevalent it is. You know, in 2015, we had over 400,000 Australians with heart failure. And there is actually a 20% lifetime risk of getting heart failure in someone over the age of 40. Now, heart failure is a very complex condition, and it requires a lot of different aspects to managing patients with heart failure. It can cost up to $1 billion per annum in terms of its healthcare spending to our economy. And a lot of these heart failure patients end up going to hospital. And their length of stay in hospital can be anywhere from a week to 2 weeks. Now, there's now an epidemic of heart failure globally and also in Australia. So a lot of patients that you will encounter will also have heart failure. It's one of the top causes for why a patient will go to hospital over 65 years of age. And the number is actually rising. There's at the moment 26 million adults globally living with heart failure. And usually these heart failure patients have a very poor prognosis. That means their lifespan is not great. A lot of them, 50% of heart failure patients will die within 5 years of a diagnosis being made. And a lot of them also have multiple other health problems. And truly, it is a huge economic burden globally. In Australia, but that's about 24% of the population of heart failure patients are rehospitalized within 30 days. And in New South Wales, this is 24%, Victoria between 30 to 33%, and Tasmania 25%. And those who get readmitted to hospital usually at times either die within 30 days of discharge, or if they get discharged from hospital, represent back to hospital fairly quickly. And this is kind of the trajectory of what the course of a lifespan of a heart failure patient looks like. Every time you have what we call a decompensation, where your heart actually, decompensates and you go into fluid overload, you actually need to end up going into hospital. And every time you go into hospital, your lifespan decreases and your progression towards the end is accelerated. So you will see that a lot of the interventions and strategies that we do is to try and keep people out of hospital so that they don't actually end up dying. So the longer you can keep them out of hospital and the less you can allow them to decompensate, the better the outcome is going to be for the patient. Symptomology, lots of different symptoms, and these all can impact the quality of life. It can be anything from irregular heartbeats, shortness of breath, swelling in the feet, can't sleep at night, tiredness and fatigue, lightheadedness, all sorts of symptoms. And these symptoms are sometimes very difficult to manage as well. So really, when you look at it, cardiovascular disease is a chronic disease. And for those suffering with chronic disease, it can really take a toll on their mental health. Also, it can really wear them down. And for those caring for people with a chronic disease, it can be very difficult as well, because these people frequently have a lot of needs and they can be difficult at times. And so it is extremely important that we really tap into God's resource in terms of finding the strength to go through a condition like that if you do have it, but at the same time to have the patience and the grace and the love to be able to care for someone going through a chronic illness. So as Isaiah 40:29-31 says, he gives strength to the weary and increases the power of the weak. Even youths grow tired and weary, and young men stumble and fall, but those who hope in the Lord will renew their strength. So truly, it is a promise of strength and renewal for those who are worn down by long-term affliction like a chronic illness. Now, the one thing that is very clear with chronic illness is that it can be prevented, and we're not doing enough to prevent it. And one of those things that really needs to be mentioned is obesity. There is a global rise in obesity everywhere. Here is a graph that shows you obesity levels in all the different countries and areas. And here we are in Oceania, where we can see that there is a rise in obesity levels. And more people are having obesity. Now, why is this a problem and how does it relate to heart? Well, we're now seeing a huge explosion of patients who have obesity, but also a number of other what we call cardiometabolic diseases, heart disease being one of them. And you can see that a lot of people who are obese also have diabetes, kidney disease, liver disease, strokes, and all of these have quite a high mortality rate. It results in quite a lot of fatalities. And there's been also significant increases in the numbers of patients getting these conditions that we can see and that we know of now. And together with obesity, you will get a lot of other sort of health conditions like hypertension and diabetes, which will then in turn increase your risk of coronary artery disease. Now, why is this important to know? Is because when you're dealing with someone with chronic illness, not just one, but many, it again poses specific challenges because we really need to have the grace and the love to be able to understand their perspective and to actually meet them at the level where they are. So that brings me to the point of how important it is to be a good steward of the body that God has given us. So our bodies are temples of the Holy Spirit, and therefore it is very important for us to care for our physical health because it's a form of worship to God and stewardship of what He has given us. And as 1 Corinthians 6:19-20 says, you do not know that your bodies, do you not know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? You are not your own. You were bought at a price, a very high price that Jesus paid. Therefore, honor God with your bodies. So that doesn't only apply to the patients that we look after, but also to ourselves. Right, because we may be very focused about looking after patients, and these may be the kind of messages that we also give to the patient, but or to people that we care for. But we must also remember that for us, we ourselves have a responsibility to make sure that we are looking after our bodies and our health. And part of it will be making sure you eat a balanced diet, making sure that we incorporate some regular exercise, making sure that we manage stress. And if you smoke, obviously don't smoke. I don't believe many of us smoke, but some people still do. And to make sure that some of the risk factors like cholesterol levels, we monitor and check on a regular basis. So tips, make sure that if you're going to go for a healthy diet, look for wholesome foods, try not to go for processed foods, and try to not eat takeaway as much or fast foods, making sure that we incorporate some degree of exercise into our day-to-day basis. Now, these are advice that we can give to our cardiovascular patients, and on patients in general, but also applies to us because we can't forget that we ourselves have to practice some of these things too. Try to incorporate at least 30 minutes of regular exercise a day, 5 days a week. Making sure we make efforts to cut the fat out of our food, make sure we look at labels when we buy food to make sure that the kind of food that we're putting into our body is actually wholesome. So a lot of processed foods have trans fats in them that are not really good for the cardiovascular system, making sure we have adequate sleep and reducing stress. Now, there are, of course, prevention strategies that have been shown to really work in terms of our cardiovascular system, and vaccination is one of them. So there's a lot of data now to tell us that vaccination against things like flu, shingles, pneumonia actually have benefits for our heart, in the sense that it can reduce the risk of getting a heart attack. It can also reduce the risk of an exacerbation of heart failure if a particular person has heart failure. So, it is good, because these are blessings that we have been given by God in a way to through healthcare, that we can minimize the impact that we can have on our cardiovascular system. Next, I'm going to just shift onto the biblical understanding of the heart. So in scripture, when we refer to the heart, we really are talking about the innermost being, the thoughts, the emotions, our will. And as 1 Samuel 16:7 says, man looks at the outward appearance, but God really looks at the heart. So it's really important that we get our hearts right with God as well. And through that, we can then be a reflection of his love and his grace. And through our connection and relationship with God, we then are able to discern right from wrong. And by immersing ourselves in the word and making sure that um, we are sort of regularly reading his word and really sort of delving into it, we really can get a lot of discernment and clarity in terms of dealing with people and even dealing with patients. So as Hebrews 4:12 says, for the word of God is alive and active, and it's sharper than any double-edged sword. It penetrates even to dividing soul and spirit, joints and marrow. It judges the thoughts and attitudes of the heart. So many a time when I'm faced with a difficult patient or a challenging problem, I would say a quick prayer to God and ask, Jesus, give me the understanding, the compassion, the love to be able to understand where this person is coming from, and to then be able to help meet that need the patient has, and give me the insights into the problems, because I may not be able to see what it is that's going wrong with the patient, or it's not evident, but please give me the guidance and discernment to know what tests to do, what sort of avenue investigation to pursue. So, living that on a day-to-day basis, I found that God has always been faithful, and he's always opened my eyes to certain things that I may not even have considered, and many people may not have considered, because I'm frequently asked to give a second or a third opinion. And it's during these times when you see a patient like that you then, they're difficult, obviously. And when you ask for God's grace and God's help in trying to diagnose the problem, or in trying to decide what to do to help the patient, God really puts insights which I would never have thought of. So truly, we do need to, we use science, of course, but we do also need to rely on God's guidance when we look at treating people. There are obviously spiritual practices that will lead to a healthy heart from a spiritual point of view. Prayer and meditation are certainly very, very important. It can lower stress, and it definitely promotes emotional well-being. For us who work in the health industry, it's very exhausting. It can be very confronting. It can be very mentally challenging, right? Because there are all these different pressures that are pulling all the time, where time poor, we're trying to cram in multiple different things at the same time. We're trying to multitask all the time. We're trying to do things well, but at the same time, not make any mistakes. So you really need to be grounded and you really need to have a strong sort of foundation because it can be very easy to get swept away by a lot of these pressures that are in the workplace. Um, Forgiveness is very important, gratitude also, and peace, because if you were to go into a hospital situation, you will see that it's very chaotic. And for me, my day is usually a very chaotic sort of a process. I get multiple phone calls as I'm doing multiple different things. So it can be very, very exhausting and sometimes very unrewarding because you have done your best for a particular person and they're not really grateful. And that makes you think, why would I want to do this? Or why am I doing this job? But again, going back to the gratitude that God has given me this opportunity to be able to be in this position that I can minister to people and help people, that really brings me back down to the core of why we're doing what we're doing. And it also reminds me of God's love for me. And therefore, it's a way that I can also share that to the people around me and the people that I'm treating. Community and love is also very, very important because we can't survive by ourselves. We really do need the prayers and the support of the people around us. And for me, that is it's made such a huge difference to me because a lot of the times you feel like you might be the only person out there fighting this battle. And it's really good to know that you have got all these other people that are behind you, that are supporting you, that are praying for you. And that frequently, you know, just reminds you again of how God can show his love to you through that and through the ministry of the people around you to you. And I just am reminded by the verse in Philippians 4:7 that says, "The peace of God, which transcends all understanding, will guard your hearts and your minds in Jesus Christ." So we do need to align both the physical and spiritual health together. And as you can see in this wheel here, there are so many different things that feed into it. But above all, it has to be Christ-centered. And to be Christ-centered, we need to build a relationship with him and spend time with him. And daily quiet time is important. So I always try to start the day, even if it's 15 minutes, half an hour, just thanking God for his goodness, committing the day ahead into his hands, and asking him to guide me and show me what he wants me to do. Of course, we need to make an effort to eat healthy and exercise, which is not always easy for us who are busy because we're always on the run. We try to tend to eat, like on the fly, so we eat unhealthy stuff. But it's making a conscious effort as well to make right choices, just as much as we advise our patients to do so. We kind of have to try and do it too. Managing stress is very important. All of us are under a lot of stress in various ways and forms, but we do need to find some way to manage the stress. And that can be anything from debriefing with a brother or sister in Christ, or, asking for prayer or praying together. And above all, I think serving people, serving others. And we do need to try and do it with love as well. So at this point, I'm just going to put up a few reflection points and maybe a call of action. Um, how are you caring for your heart, physically and spiritually? Just a little bit of a reflection. I'm sure all of us can find ways that we can actually change the way we care for our heart physically and spiritually. what kind of small steps can you actually take today? Simple little things that you can make that will go towards caring for your heart physically, but at the same time, spiritually too. And as Psalm 73:26 says, my flesh and my heart may actually fail, but God is the strength of my heart and my portion forever. So, if we have a strong foundation in God, then a lot of our physical um, body will fall in place, and we will follow the principles to look after it if we are truly aligned with God too. So a few online resources for people who might be interested in it. There is My Heart, My Life, which is a free online program for people who may have had heart attacks or cardiovascular disease. It provides a lot of support and education. There's also Beyond Blue, which offers information and support for mental health, which can be important when we're dealing with chronic conditions like heart disease. And then there's, of course, the Heart Foundation, which you can look online, which has a whole heap of things on healthy living and education about heart stuff. And the Heart Support Australia group, which gives people confidence to communicate with their doctors and find ways to express themselves, because sometimes they're not sure how to say it, they're too afraid to ask the questions. But this is one website that can help people overcome that sort of thing. So at this point, I think I'll open it to discussion and questions, because if there's anything that anyone would like to know or ask about, I'm happy to try and answer and talk around